Well, my opponent brings up the point that the U.S. is a wealthier country and high population that it needs to spend more on healthcare. But I would like to remind everybody that even though some of the nations in, for example, OECD countries, even though they're not as wealthy as the U.S., some of them do not suffer from the same budget deficit as the U.S., which means that they do not necessarily lack investment to put into their healthcare system. A congressional report on the U.S. healthcare spending used OECD data and reported that the average OECD country, or every OECD country, experienced larger gains in life expectancy than the U.S. between 1960 and 2000, while spending less than the U.S. Granted, this is about like 29 countries. So, and I'd also like to note that despite life expectancy isn't the best way to measure, as my opponent might also claim. But I also do have the stats that in a OECD Health Data 2010 report that infant mortality rates in Canada, as in other OECD countries, have fallen greatly over the past decades. It stood at 5.1 deaths per 1,000 live births in 2007, which is lower than the U.S.'s 6.7 for the same year. I'd also like to share with you guys a personal claim of a man named David Lacey at Port St. Joe, Florida, a winter resident from Nova Scotia who was published in the Herald newspaper, writing as an answer to the article I mentioned earlier, stating that his mother, 91 years old, was living in Nova Scotia, Canada, and fell in her kitchen and gashed her head. Ambulances arrived about like 10 minutes later, and she was stabilized and sent to a hospital 15 minutes away. She was being stitched when her heart stopped. She was revived immediately, sent to an operating room where a pacemaker was installed. And this was, the cost for this was nothing, and nobody asked her or us or them if she wanted to die. The congressional report on U.S. healthcare spending shows that a lot of the extra expenditure in U.S. is caused by the practice of providing extra medical care that provides little or no additional health benefit. This is like cosmetic surgeries and things like that. And